Welcome back. South Africa's response to the COVID-19 pandemic last year was marred by reports of corruption. And Corruption Watch, in fact, received an average of 11 whistleblower reports per day during the course of 2020. This is revealed in the organization's annual report titled From Crisis to Action. To discuss, we're joined by Corruption Watch campaign coordinator Sabehaah Motala. Ms. Motala, thank you for being with us. How does 11 reports a day from whistleblowers compare to previous years, say?
The number of reports we received in 2020 is actually our second highest number of reports since Corruption Watch opened its doors in 2012. And I think what was really interesting about the past year is that we had a new kind of report relating to COVID-19 lockdown and other measures around COVID-19. So that was a new thing that was reported to us last year.
And what does it say about how the pandemic created opportunities for corruption, or alternatively, I guess, exposed corruption?
So I think in terms of creating opportunities for corruption, unfortunately, in times of crisis and increased vulnerability, South Africans and South African legislation and procurement systems, for example, were hugely exploited by people looking to line their own pockets. And I think it says something really sad about the culture of corruption that persists in our country, that at a time when, we're relying on frontline workers, on healthcare and on the ordinary, cashiers in supermarkets, that they were exploited for their vulnerability. And also people who had lost their jobs and had families to feed were also exploited for their vulnerability.
Yeah.
And in terms of exposing it, there's a huge direct link between COVID-19 corruption and actually access to healthcare and access to human rights. And so, yes, it did expose just how corrupt some entities in this country are.
Yeah, because I guess the positive side would be that people are aware of Corruption Watch, that they can report, they're more aware of corruption. It's being talked about and of their own rights as well.
Yes, I think it's a time when for the first time for many people, corruption has directly impacted upon them. So, paying a lot of money for PPE because of inflated prices and procuring them, or even in accessing the temporary employment relief scheme that has directly affected a number of people for the first time.
Yeah, and that temporary employment relief scheme, the TERS, that fund was part of the relief effort. I mean, was there a big portion of complaints around measures that were meant to help people withstand the lockdown?
So out of the total 418 reports that we received directly related to COVID-19 corruption, 37% of them came were related to the TERS benefits. And this, for example, would be where employers would sign up their employees, but then the employees would never see that funding into their own pockets. So that is also an example of how private sector participates in corruption as well.
So, worryingly, the highest number of reports implicated the policing and healthcare sectors in a pandemic. Just tell us the types of cases that people were reporting, and maybe let's look at both policing and healthcare.
So, in terms of the types of corruption, we've received a lot of reports relating to maladministration, procurement, fraud, abuse of power, and bribery. In terms of policing, this is something that has been highlighted for a number of years. That there's a lot of corruption in the police, and particularly also in relation to the implementation of COVID-19 lockdown regulations. The police is a sector that's particularly vulnerable to corruption because they do hold a certain power over people to withhold people's rights, and that puts them in a position to abuse that power for their own benefit. And then in terms of the healthcare sector, this is also a sector where corruption has often been highlighted. Largely in relation to employment and procurement, where prices are inflated, or you have to sort of know someone to get a job, so there's nepotism, and that kind of corruption happens in the healthcare system.
Yeah, and like you mentioned, PPE. Very quickly, so Corruption Watch obviously has only a certain amount of capacity. What is done with these whistleblower reports? I mean, your report is titled From Crisis to Action. How do you move to action?
So our whistleblowers are our first port of call. Without information of how corruption is actually happening, we can't do anything about it. What we do with those reports is select investigations. So for reports that have a lot of evidence or a chance of a good outcome, we will investigate those. But largely our work is centered around building a public mobilization and advocacy campaigns. So where we note these hotspots of corruption, for example, in policing and healthcare, we can use that information to build public participation campaigns, but also advocacy. So for example, with policing, this year we've just launched our veza.org.za online tool, which is to improve transparency in the police. So you can go online, check out your local police station, what resources they have, report police corruption there, but also nominate ethical police officers to try and change the narrative. And then in terms of healthcare, we're part of a national forum for anti-corruption in the healthcare sector that brings together a number of stakeholders, including government, civil society, and healthcare practitioners as well, where we can refer reports of corruption to be dealt with.
All right, we have to leave it there. Thank you very much. That was Corruption Watch campaign coordinator Sabehaah Motala.